Hello, my name is Christopher Lacourte. I am a licensed clinical social worker specializing in geropsychology. I've been assigned to the Georgia case, a 7-year-old woman who is a resident in a independent living community where she's lived for about 2 years now. Georgia's in good physical health, overall managing blood pressure and arthritis with medication. Her family is about an hour and a half away, and she does get frequent visits every weekend from her children and grandchildren. It does get bumped up during the holidays. Recently, however, the staff has begun to notice some concerning things, such as Georgia missing meals. She mistakenly left her front door open, and the last visit she had, her grandson Jack was called David, which is the father. So she's beginning to be confused with some emerging cognitive challenges. Georgia remains independent and mainly in her daily activities. Based on these symptoms and preliminary assessment, Georgia appears to be experiencing major neurocognitive disorder, commonly known as dementia. This falls under the category of neurocognitive disorders in DSM-5, which involve significant declines in cognitive functioning that interfere with independence. Specifically, it seems like a mild form, possibly Alzheimer's disease, the most common type of dementia, accounting for over half the cases, characterized by memory loss and apathy. The severity here is mild as of right now, as Georgia's impairments are not yet severe enough to require full-time care, but they are progressing and impacting her safety and routine. Like I mentioned, she left her door open, which wouldn't be concerning, except it's like an apartment where it's outdoors and not internal, where there's a security there. The key symptoms include diminished memory for recent events, such as forgetting her meals, confusing family names, and potential lapses in judgment. Like I mentioned, leaving the door open. These align with the DSM-5 criteria for major neurocognitive disorder, where cognitive deficits in at least 2 domains, memory, executive function, are evident, reported by informants like the staff, their family, and represent a decline from her previous functioning. If untreated, this could worsen, leading to greater risk like wandering or nutritional issues if she's missing meals. Honestly, the rate of decline is mild neurocognitive disorders such as early Alzheimer's varies widely. Some may experience slow progression over 2 to 4 years in the mild stage, with an annual risk of advancing to more severe dementia around 8% to 15%, while others will remain stable longer, or even see some reversion with interventions like overall health and early treatment. These play a big role, so regular monitoring is essential here. Treatment protocols for the neurocognitive disorders like that of Georgia's, these would be donepezine, cholinesterase inhibitors. This can help slow cognitive decline by boosting brain chemicals involved in memory. Though they don't reverse the damage, it may cause side effects like nausea, especially with their underlying medication she's already taking, like her blood pressure. These are crucial to vascular contributions to dementia. Psychologically supportive psychotherapy is recommended, including education for Georgia and her family. I think this is the most important part, and I'll get more into it here. Knowing the diseases and behavioral stages, like using external memory aids, like calendars or alarms for her meals, this is important so she gets the nutrition that she needs. She's got some doctor's appointments coming up. Having a calendar that has this highlighted, very important. Engaging in activities. I always see the patients decline when they're stagnant, they're not doing anything. If they're working, that's good, but only in small cases. And engaging activities such as music therapy, just to reduce some agitation. If she's got a hobby, dancing, something like that, as long as she's not putting herself in danger, I view these as good things. Exercise and cognitive training programs can also prevent further decline. There's apps for this. You can download them. They do have some monthly subscriptions. However, some are free. With studies showing small benefits in mild cases for some out-of-the-box preventative measures, this is me thinking more along the lines of what we could possibly do than if the other ones don't work, right? Emerging research suggests creatine supplementation, commonly used for muscle energy, may boost brain energy and improve cognition in older adults that are risk dementia. Though it's preliminary and should only be started under medical supervision. Additionally, encouraging Georgia to create a journal with some pictures. This includes that of her family members and making sure she writes these family members' names down. If it, for whatever reason, progresses at a rapid rate and she starts forgetting things at a substantial level, this could definitely damage relationships. I know it can be difficult for family members to go through this. That's why we want to make sure that we can have a way to ensure Georgia is more comfortable in memorizing these things. This can also stimulate the cognitive health, reduce isolation, and enhance mood by preserving visual memories and providing a low-pressure way to engage her brain daily. To help Georgia, I recommend a full neurological evaluation to confirm these diagnoses, rule out reversible causes like medication, side effects, involve her family in the planning, perhaps bring them in, increasing visits or using technology for reminders. Like I said, there's apps for these kinds of things. You can even have the family set up certain alerts on a calendar on their smartphone. Early intervention can improve quality of life. We should focus on supporting her strengths while addressing these challenges. Like I mentioned earlier, it's not going to be easy for the family. However, I believe, especially with someone who's dealt with this in my own family, that the only way that we're going to get through this is with family strength, and it takes a village. So with that, I'm going to leave you there. I appreciate your time. If you have any questions going further, please let me know and reach out to me. Thank you.